No one can really understand what we're going through until they walk in our shoes.
People who breathe as I do share so many experiences, but in reality, our feelings and situations, they're all different.
A tracheostomy is a temporary or permanent opening in the trachea or windpipe, created surgically under general anesthesia. A tracheostomy tube, when slipped through the stoma or hole in the windpipe, restores normal breathing to ease severe respiratory problems.
Historically, the first tracheostomy was performed as an emergency procedure to create an airway in a patient struggling to breathe. Today, there are many reasons for needing this simple, routine medical procedure: to bypass an airway obstruction, to help with long-term breathing problems, or provide a temporary airway during healing after trauma or severe respiratory illness. Whatever the reason, the purpose of a tracheostomy is to help you breathe easier.
Tracheostomy tubes come in a variety of styles and sizes from different manufacturers. All dual cannula tracheostomy tubes consist of 4 parts: an outer cannula, a flange or neck plate, an inner cannula, and tracheostomy ties. Additional accessories may be included in the package. One tube, the outer cannula, fits into your windpipe through the surgically created hole or stoma. It holds the tracheostomy open. A smooth-surfaced obturator guides the tracheostomy tube into position. A protective flange covers the stoma and anchors the cloth ties or Velcro straps that secure the tube. The inner cannula is locked inside the outer tube to prevent its expulsion during coughing. Your tracheostomy tube may have either a reusable or a disposable inner cannula. Your medical team will instruct you on how often to clean your reusable inner cannula or how often to change your disposable inner cannula. After you leave the hospital, a few essential items will help you to maintain your tracheostomy tube and make life easier. Most of these items will play an integral role in your daily care routine. For day trips, pack a few extra things in a small tote bag or backpack to help you clean or change your tracheostomy tube while you're away from home.
People in all walks of life, including presidents, Supreme Court justices, and baseball players, have used a tracheostomy tube to restore normal breathing. The procedure itself takes less than 30 minutes. You'll probably have a sore throat for a few days after surgery. At first, you won't be able to talk, so you need other ways to communicate. It's a good idea to keep a pencil and paper or an electronic keyboard handy. Your vocal cords are located above the tracheostomy tube. If air reaches them by passing around the tube or through holes in a fenestrated tube, you may be able to speak. Or, a speaking valve can be placed at one end of the tube, which may help you regain speech.
Over the next few months, your healthcare team will be there to help you adjust to a new way of living and breathing.
In the hospital, a doctor or nurse will teach you about tracheostomy care. At home, a family member, home care nurse, respiratory therapist, or caregiver will help you until tracheostomy care becomes part of your normal routine.
You know, the first time you do something new, you'll probably need help. Gradually, you'll need less help, and eventually, you'll be able to do most of it by yourself.
Suctioning your tracheostomy tube, cleaning the inner cannula, replacing ties, and stomach care will all become routine activities.
Mucus glands lining the trachea or windpipe humidify inhaled air and trap foreign particles. Along the tracheal walls, hair-like cilia sweep mucus and particles up the throat, triggering a reflex to cough them out. Mucus secretions can clog tracheostomy tubes, which lack the windpipe's natural self-cleaning ability. Cleaning the inner cannula prevents airflow restriction and makes breathing easier. You should clean the inner tube or cannula of your tracheostomy tube every 4 to 12 hours, depending on your muscle strength, neurological status, activity level, ability to cough, and the amount and thickness of mucus secretions. Before you begin, don't forget to wash your hands thoroughly. To clean the inner cannula, fill one bowl with mild soap and water and another for rinsing with sterile water. To clear mucus from the tube, use a pipe cleaner or tracheostomy brush.
Everyone develops their own cleaning habits. Whenever my breathing feels restricted, I clean my tube. Some days that means every couple of hours. Other days, just in the morning and at night. It depends on what works best for you.
You might also need to suction your tracheostomy tube. The frequency of suctioning is based on the amount of your secretions or as indicated by your doctor or home health care provider. Before you begin, wash your hands. Suctioning the tracheostomy tube with a suction machine is a very easy and simple process, which will take about 10 seconds of your time. Having a tracheostomy should not interfere with most of your normal activities, but you can expect some changes in the way you do certain things. Since air travels directly into your windpipe, your nose no longer moisturizes, warms, and cleans your airway as you breathe. A number of simple steps can help you to humidify inhaled air, thin the natural mucus secretions in your windpipe, and protect your airway from foreign objects. A heat moisture exchanger which fits over the outer cannula can humidify the air you breathe. A humidifier on every level of your home can maintain humidity at 40 to 60%. Remember to change the filters regularly and to clean and rinse your humidifier with water and vinegar. Drink plenty of fluids, at least 6 to 8 glasses every day. After a tracheostomy, you need to change the way you take showers and baths. You will have to be careful and prevent water from getting into your open airway. No splashing. In a shower, the water cannot hit you any higher than chest height.
It's harder when you need to wash your hair. I wrap a towel around my neck to cover my tracheostomy tube.
A shower shield can protect your airway from water infiltration. For convenience, you may choose to replace soiled tracheostomy ties after showering or bathing. You only need to change your ties every 2 to 3 days or when they get dirty. To replace your tracheostomy ties, you will need some twill tape, scissors, and sometimes a helper. Replacing your tracheostomy ties is easy once you get the hang of it. Sometimes swallowing food or liquids can be difficult when a tracheostomy tube is in place. These few tips can help you to ease swallowing problems. First, sit upright to eat. Eat slowly and chew your food well. Think only about swallowing. When drinking, take short sips as liquids are harder to swallow. Avoid food with seeds. If you're using a cuff tube, consult your healthcare provider regarding cuff status during meals. While you're in the hospital, a doctor or speech-language pathologist will evaluate your ability to swallow and offer some helpful tips more specific to your needs.
An open tracheostomy tube is a direct route to your lungs. Keeping airborne objects from flying into the tube is an issue, but in no time you'll learn how to manage it.
Here are a few common airborne objects and substances to avoid. Your daily experiences will dictate what items to add to this list.
Cold winter air may make it difficult for you to breathe. In really frigid air, you have to protect your lungs against frostbite. Wearing a scarf and a heat moisture exchanger over your tube helps.
Since my tracheostomy, I sometimes have to cough to clear my throat and lungs. At first, I kept apologizing to everyone because I thought I was disturbing them. Now my friends and my family are used to it, and I don't feel uncomfortable.
I cough a lot, but that doesn't mean you will. Just make sure to keep a handkerchief handy.
Living with a tracheostomy tube is challenging at times, but there are steps you can take to ease your difficulties. For example, the tube may shift position slightly when you cover it with your finger to talk. Changes in tube position can cause coughing, scraping, and sometimes pain. Repositioning the tube properly usually resolves the problem.
If you have a constant cough, check with your medical team. You may have respiratory issues or an ill-fitting tracheostomy tube. Work with your medical team to obtain a better fitting tube or clear up any breathing problems. The area around the tracheostomy hole or stoma needs daily care. You will need a clean washcloth dedicated for this task, foam swabs or tweezers, a well-lit mirror, and if you need it, a replacement dressing. Remove your old dressing. Before anything else, wash your hands thoroughly. Wet the washcloth and gently cleanse the area around the stoma and between the stoma and outer cannula. A swab or tweezers can reach hard to clean areas under the neck plate. Examine the stoma site carefully to check for redness, swelling, or other signs of infection. Then, replace the dressing, if needed, with the open ends up.
What I remember most is feeling scared when I couldn't breathe. That happens sometimes when I have a bad cold or my asthma really acts up.
If you have trouble breathing, your tracheostomy tube may be blocked by mucus. Cough hard to dislodge secretions or remove and clean the inner cannula. There are also times when you should contact your medical team immediately. For example, if you have a high fever or changes in mucus color or consistency. If you cough food or blood out of your tracheostomy tube, or food or liquid leaks from your stoma. In an emergency, you and your family should know what to do and have the appropriate phone numbers at hand.
You know, you don't see a lot of people with tracheostomy tube in public. I sometimes get odd looks, but it doesn't bother me anymore.
There's a lot of people here to help us. I never hesitate to ask for support when I feel I need it. It makes it so much easier.
Now I am just thankful that I have the ability to breathe. And I appreciate every breath, every breath.